As an orthodontist, it's interesting. When I first started practicing 30 years ago, kids would think it would take 2 or 3 years for braces, which was typical at the time. And then about 10 years ago, it shifted to less than 2 years. But now, every teenager walks in and you ask them, how long do you think you should be in braces? They go, oh, less than a year. And the beautiful thing about the Carriere system is we can meet that expectation virtually every time. Typically, when an orthodontist looks at a patient, we've all been trained to look at 3 different dimensions. So we have the front to back problem, which is what most patients call their overbite. We have the vertical problem and the width problem. And I was trained, and most orthodontists are trained, that the very first thing we do is address the width, because if the arches don't fit together, then you have problems with growth. With the sagittal first approach, what we do is correct the front to back problem first. And with the motion devices, we kind of turn that on its end and correct the sagittal first in a very short period of time, typically 3 months. Sometimes with very difficult adult malocclusions, it might take 6 months. And then what we have is a class 1 or malocclusion, because the teeth have not been aligned yet, that are easily correctable either with the SLX brackets and wires in 10 or fewer months, or with Invisalign, and sometimes simply Invisalign Express. Our biggest competitors now are no longer competition. So we look at things like 6-month smiles that are often performed by general dentists who have very little training, and they line up the front teeth and the patients think they're finished. Well, sometimes in 7 or 8 months, we are completely finished with treatment with a perfect occlusion and every single part of the aesthetic paradigm accomplished. And so now when patients come in from second opinions that possibly have seen their primary care dentist, I can look at them and say, yeah, we can do that even in less time with a better result. One of the more exciting things to come along is the clear motion that from conversational distance you can't even see. So the adult patients that might have balked, who were coming into the office to ask for Invisalign, and we'd explain how we can finish them in such a shorter period of time using the sagittal first approach, now we have an appliance that meets their aesthetic demands and marries beautifully with any sort of aligner system. And so from start to finish, we have an invisible process that's also efficient and meets the demands of the orthodontist to have a proper end result.